Eating disorders are serious but treatable illnesses with medical and psychiatric aspects. The eating disorders most commonly known are anorexia and bulimia, but there are also other eating disorders that affect college students, such as binge eating. Oftentimes, eating disorders coexist with depression, anxiety, or obsessive-compulsive disorders. People with an eating disorder typically become obsessed with food, their body image, and weight. These disorders can become very serious and life-threatening if not recognized and treated. There are still many myths associated with eating disorders. Learn the facts so you can help yourself or a friend.
People with eating disorders are really easy to spot because they're really thin.
You can't always tell if someone has an eating disorder. It is a myth to assume that people with eating disorder look very skinny or emancipated, and that's just not true because there's different types of eating disorders or disordered eating. Some people can be overweight or even average weight and they still have eating disorder. Some people might binge and go on these excessive eating spells, but then will purge or use laxatives or exercise excessively afterwards. So the weight may actually maintain or look the same even though they do have disordered eating. So no, you cannot always tell or spot someone who has eating disorder.
Eating disorders are not fatal.
Eating disorders can be fatal. That is absolutely the myth to think that they're not fatal or they're not harmful. Just because you're messing up your body. A lot of times you're weakening your immune system. You can have heart problems. You can have ruptures in your stomach. Electrolyte imbalance. So yes, eating disorders can be fatal, especially chronic eating disorders. Even just, some people think, well, if I just do this for a little bit, then I'm safe. No, the physiologic of your body is being all messed up, and yes, it can absolutely be fatal.
You can never exercise too much.
All the exercise usually is very beneficial, and we do recommend that to have an active lifestyle. It is a myth to say you can exercise too much, especially people who exercise based on anxiety. There's not like any fitness goal to exercise anxiety. They usually get very compulsive about it, and they might work out a couple hours a day, not take breaks, not recovering, and that's just not a good idea. One, from a physical standpoint, if you exercise that much, your body's going to break down. But also just as a mental point, if you're exercising that much, chances are there's something else going on. It might be either insecurity about the way you look or body image or comparing yourself to other people. And using exercise to cope with that is really not effective because you're not really addressing the problem. You're just pushing yourself and pushing yourself. And then whereas exercise is supposed to energize you, you make it to the point where it's actually draining you, and that's where it becomes detrimental.
Eating disorders are always about food.
It is a myth to assume that eating disorder is always about food, but most of the time, the food is actually a symptom of an underlying emotional issues. In fact, in treatment with eating disorders, a lot of times we focus on how to cope with stressors or the underlying negative emotions. A lot of people with eating disorders, they might struggle with anxiety or insecurity about the body image, again, or compare themselves to other people. Those are underlying emotional factors, and a lot of times they'll turn to food to either try to cope with it or to have some sense of control. So it is a myth to think it's all about food, and some people think when they come to counseling that's what we're going to talk about is food all day, every session is all about food, and that's not the case. So we really would talk about coping and getting the underlying emotional issues and how to deal with those.
It is estimated that between 2 and 10% of young females in this country have some type of eating-related illness, and the incidence of eating disorders in males is also increasing. If you have a family member or a friend with an eating disorder, or if you are afflicted yourself, please seek professional help for this illness. For more information, please visit our website at www.counseling.tcu.edu or call 817-257-7863.